You're now listening to the Adiel Gorel Show. Each episode, I'll bring you the latest news from my discussions with top health and wellness experts so that you can bring yourself into better health. Today, on the Adiel Gorel Show. When people think about HPV, they think about a sexually transmitted disease happening in your pelvis region somewhere. Now you're talking about throat. So people might be listening, is this from, oral sex? How do you get it? Can you get it by kissing? But I'm confused. I understand that. And it's basically prevention is important. Now, if I understand correctly, your specialty is liver cancer.
Yes, one of my specialties. I did my fellowship in GI and liver pathology. So during my fellowship, I did have a chance to see a lot of liver cases, and particularly with UCLA being one of the largest transplant centers in the world. So we did see a lot of diseased and normal livers for the transplant.
What do we need to know about liver cancer? I mean, the liver is certainly a very much, abused, organ in our bodies. Yeah. So what can you tell us about it, and what can we do to be kind to our liver?
Well, this is a great question. Being kind to liver, I think, is a great term. So liver cancer, the risk factors for liver cancer include viral hepatitis, whether hepatitis B or hepatitis C. A lot of times these, of course, happen, and that is something that most of the time is unavoidable. But other risk factors that are avoidable is alcohol. People with alcoholic liver disease and liver cirrhosis develop cancer. And this abuse of alcohol and excessive use of alcohol is responsible for a lot of things in our life and in the medical field that I don't think it's getting enough blame. But you think about what it causes. Actually, it increases the risk for throat cancer, by the way. But you have a lot of other things that can happen as a result of alcohol. So I think not drinking alcohol or drinking in moderation it is definitely important. And again, about the car accidents and all the other things that can happen, and the anger and rage that happens when people get drunk and out of control. So I think alcohol is one of the main things that could lead to cancer, and I think it's something that could be completely avoidable. There are other genetic conditions that can result in cancer. Those are not avoidable. And then there are some chemical exposures that can happen. Certain dyes, certain chemical materials can result in cancer. So all of these are factors that result in increasing the opportunity for people to develop liver cancer.
So alcohol is a known offender. What about our food? What about what we consume on a daily basis? What could be a trigger to abuse the liver, and what could be good for the liver?
I think the easiest, and I'm not really well versed on all types of food that can cause cancer, but I can tell you the one that comes to mind right away is the high fat diet, because non-alcoholic steatohepatitis, NASH, is also a condition in which there is an overload of fat on the liver, can also cause cancer. So that is another way that, unfortunately, the American diet is guilty of this ridiculously high fat and low fiber too. So this is something that comes immediately to my mind, which is like that high fat diet. And also within my field is colon cancer. Colon cancer happens in patients that ingest. That one of the risk factors is that high fat, low fiber diet.
Fats could be segregated into relatively good fats for us because we do need fat.
Of course.
and bad fats. It would make a difference. I mean, if people would, consume good fats and maybe don't consume the bad fats as much, right?
Right. The nutritionists have done an amazing job in explaining that, and you can find a lot of information about that. But I personally don't have a lot of knowledge about the types of fats, meaning that I don't really feel that it is my field to advise on things like that.
Of course. I understand very well. I think, though, that we can logically assume that people are talking a lot about the harm of highly processed foods, highly processed oil, highly processed in food coloring. I would assume that would be hard for the liver to handle.
Of course, yes, because the liver is where detoxification takes place, and you keep throwing things at the liver. Eventually, it will get diseased, and liver cancer is one. But you have a lot of other types of hepatitis that we see, and some of them actually are therapeutic. Medications that you can ingest. When I was in my residency, I had a fascinating case where a patient who had hepatitis C and HIV, and she was on a medication for HIV, and we were looking at her biopsy. She had like a liver failure. So we were looking at her biopsy, and we saw this very distinctive look, something called oncocytic change, where the cells are loaded with mitochondria. So I decided to examine that. But this is one of my very few publications. I did a case report on it because what we identified is that this particular medication causes damage to the mitochondria, rendering them ineffective. So that results in something called compensatory proliferation, where the mitochondria is not being effective, so they kind of continue to produce more and more, and then you get this oncocytic look, and it was a damage happening by a medication. So it's the liver can withstand a lot because it's a fairly large organ, but there is a limit to that. And we cannot just keep hitting it with a lot of things. Imagine somebody doing this and drinking alcohol and having high fat diet. It's just it's not fair.
Now, two cancers that are very well known are breast and prostate. Is there anything you can add related to those?
So I don't do a lot of uropathology, but I have been fascinated by the acceptance that every man at a certain age would develop prostate cancer. I kind of really find it a very hard thing to accept, because I think it's I think humans do not possess that faulty design. There is something, I predict there is something that's going to be discovered that we in the modern times are doing that is causing prostate cancer to develop, because I don't really think that this is scientifically logical. There must be some kind of damage happening, or some changes that are happening resulting in the development of cancer. But that's my thought on prostate cancer. My thought about breast cancer is a little bit difficult to discuss, because we're dealing with something like this in our family. But I can tell you that like every other cancer, early detection is a lifesaver. The earlier you detect, the better. So encouraging every woman to go for her pap, and to never ignore anything that doesn't feel right. I think the self-examination that happens, when you're in the shower is something that needs to happen religiously, because, the earlier you detect it, the better. Now, there are also genetic predispositions to breast cancer, things that are, unfortunately unavoidable. You're born with it. And for every woman who's dealing with that, to make the decision to be proactive and to try to protect herself and family from dealing with cancer. And I have a lot of friends. I have a couple of friends actually that they proactively went and did the mastectomy when it was identified that they have the gene for breast cancer.
This is clearly, and I don't think it's going to be your area, but I just wonder what you think about it. Obviously, we keep using Wi-Fi and Bluetooth and all kinds of radiation in our homes. Now the homes are striving to be smart homes where many devices communicate with each other and with the world at large via Wi-Fi. Many people carry a little strip on their wrist that communicates with the Wi-Fi, with their phone, the phone itself. Now, as technology moves forward, we move from G2 to G3 to G4 to G5 to G6 to G7. Every such jump requires a higher frequency of wave. I mean, the waves are more frequent. The radiation is more potent. Yet we remain these little soft creatures, and we are the same now as we were 1,000 years ago. What do you think all this enormous sea of radiation is doing to promote cancer?
I would not be surprised if it becomes a discovery in a short time that these frequencies have impact on our health. I wouldn't be surprised, and I actually think that I think there is going to be an evolutionary change in the human brain also about this attention span with all of these distractions that we're having too. I think that, and this is probably going to be fast tracked than what you and I expect, because we think that changes take thousands of years for humans to evolve. But I want to tell you that I see things that, the short attention span is going to be a thing, but I don't want to get out of your question. I think this is likely to happen, that all of these frequencies, all of these radiations, all of this exposure could eventually result in cancers, but it could also result in other behavioral changes.
Well, short attention span for sure. Even the Pavlovian getting used to walking around with a brick, and right. The brick has much of the knowledge of the universe right in there, plus the new. So it's very, in fact, by doing this podcast right now, you and I are somewhat of a dinosaur type, because ideally, if we want a lot of people to listen and to view this, it should be a 5-minute podcast.
Right. Yeah. But hopefully the car drivers will appreciate it.
Car drivers, the captives. But even they have so many. They have books on demand. They have music. They have phone calls to make.
Also, they have to be driving alone, because you don't know that their companions would really enjoy you and I talking about all this stuff.
Right. So that's quite interesting. Obviously, we live in a world that's not conducive to interact with our soft, fleshy self, which never changes. And yet, it's like almost war. When armies used to fight in the past, they used swords, they used shields, stuff of that nature. Now you have certain bombs that can, but we remain the same. So with one such bomb, now you can kill 1,000 people. In the past, so that's what happens also with everything else. And I think when it comes to radiation, because people can't see it, it doesn't exist.
Yeah. No, and this, by the way, this applies in a lot of things that we do and advocate, where this is why we want to be proactive about things, because we bring things to the light that people don't even talk about. They don't really think about. And one of the things that got me to pursue this throat HPV is that I'm looking at a cancer where 2023, there is a cancer that is rising and nobody's doing anything about it. If you read about it, they tell you vaccination. You know that actually vaccination is not indicated for throat HPV. It's not an indication. HPV-related throat cancer is not an indication for HPV vaccine. The vaccine is important, but we need to basically have people talk more about the issues. Cancer that is rising needs to be addressed. We need to do something about it. And I tell people, testing for HPV is better than not doing anything. What's the alternative?
Well, I want to make sure that people are not confused by a couple of the things that we are discussing. Because, when people think about HPV, they think about a sexually transmitted disease happening in your pelvis region somewhere. Now you're talking about throat. So people might be listening, is this from, oral sex? How do you get it? Can you get it by kissing? But I'm confused. The listener might easily say, I understand a sexually transmitted disease that happens where the sexual, organs are. I understand. Right. You bring the throat into it. Tell me, do you get it when you kiss? Please say some more about this.
Yeah. So it's oral sex. I mean, oral sex is the way it transmitted, and oral sex is something that needs to be discussed when you are taking as a healthcare provider, taking history and discussing your patient's lifestyle and practices. That is, yes, it is oral sex. And also, the thing about it, also the multiple sexual partner. That is another level of risk that happens with HPV infection. So educating people about that is important. And this is the ideal patient who thinks that it's only going to affect below the belt. We know now, if we're talking to somebody who thinks like that, then we are doing something right because we're educating people. And educating people with the right information without making people feeling panic. This is an infection that it's better to be diagnosed than to just go about thinking about you're fine, everything is good, and then you come back with a neck mass and you have throat cancer. Because every year we have about 19,000 people developing HPV-related throat cancer.
But still, just to make the point entirely clear, you do not get HPV in your throat from kissing.
I think kissing is a possibility. I can't say that kissing doesn't cause it, because if you're kissing somebody who has throat HPV, you can probably exchange saliva and things like that could result in it. Kissing is one way of doing it, but the main mode is oral sex.
So if you were to give our viewers and listeners just a general, what do you do? What should we do? What is your your lifestyle? What is it that we can do to help our well-being, not just in this regard, but in everything else that you practice or that you know about?
So I can tell you that one of the things that I started doing recently, and I learned that from my son, is meditation. I try to meditate twice a day. I do transcendental meditation. I actually, went and took a class here in LA, and it was extremely helpful. And I think meditation helps me significantly because it calms my demeanor. It organizes my thoughts. It does really help me with productivity. Sometimes I have very busy days where I have a lot of cases, lots of slides to review. And a lot of times it's 2 or 3 p.m. and I have a mountain of slides. And I look at it and then I say, okay, and I just walk away, sit down, do my 20-minute meditation. I come back and I'm working as if it's 8 o'clock in the morning after a good night's sleep. So it does really help me a lot with my productivity. But it helps me in also dealing with things and problem solving and things like that, because I kind of really need to be calm to address any issue in my life. Active lifestyle, just walking. I I play croquet competitively, so I do walk frequently when I'm on the croquet court. That is a really good activity for me. So, but being active and not sitting at the microscope, and I'm guilty of that. Sometimes I just, because you get in a zone and you feel like you're doing well, and the more you sit, the more productive you are. But I try to force myself to get up and take a walk, so not sitting for a long time, but having an active lifestyle, I think, is good. Good night's sleep is a thing for me. I mean, you really, people have to actively pursue a good night's sleep. You cannot just get by with 3 hours, 4 hours, staying late, waking up early, having interrupted sleep. Poor sleeping habits can be detrimental because it impacts our immunity system, and it impacts our mood, it impacts our focus, and it's extremely dangerous. Driving a long distance after 2-3 hour night sleep is really dangerous activity. So I think having good night's sleep and then eating well meaning that you have to really make sure that you're eating lots of fruits and vegetables. These are really important. We don't have much of that in our diet, but we have to really get the good health. Talking about gut health, I think yogurt is one of the most important things that you people need to do. Every morning I have yogurt because I think it's good for my gut health. So there's so many things that we do, but at the end of the day, I try to really handle stress. I try to make sure that I'm handling stress, and handling stress, mental health is something that also cannot be ignored and neglected, because you need to have a clarity of mind to deal with life, anything in life. You cannot be successful, you cannot be productive if your mind is not clear. So I'm sure that there are other people that have much better advice than this, but I answered this exactly what I try to do in my life. But every now and then I get my Pepsi or Coke or drink, soda drink. I want to do that. I do it. I get a croissant every weekend because I love croissant. So I'm not making myself miserable. I just, I try to enjoy life as well.
Is there a way where people can follow your work, or is there a website that you have? Or
yes, so we have a YouTube channel in which I'm putting my lectures and I'm putting interviews and things I'm talking about. So we have that. I'm on Instagram and Facebook, and coming soon, I'm going to have a TikTok with short videos talking about these little things that we talk about.
Well, Dr. Kamal, I know you're extremely busy and you have your slideshow to do every day, but I'm very grateful that you found the time to, enlighten us and to talk to us. Thank you so very much for being here.
Thank you, and I really appreciate the invitation, and I'm really honored to be talking to you, and I think I really admire the things that you're doing, and the fact that you're pursuing wellness and health is an amazing thing, and thank you for that work.
Thank you. All right. Looking forward to seeing you in the future. Bye-bye.
Likewise. Bye-bye.
Thank you for joining me today for the second part of our amazing interview. If you didn't catch part 1, don't miss out. The link is in the description below for you. And be sure to click the subscribe button for more videos.